Well, for more on Brazil's handling of the pandemic, I spoke to Gustavo Ribeiro via Zoom. He's the author of the Brazilian Report. I began by asking him his take on some states relaxing their lockdowns.
I think it's too soon because we actually don't know exactly what is the extent of the pandemic in Brazil. Data in Brazil is extremely unreliable because each municipality has its own way of compiling data, which is not necessarily the same as other municipalities. And we have a big gap in testing. For instance, the US is by no means a world standard in terms of COVID-19 testing. But the US has tested around 17,000 people per million inhabitants. Brazil has tested 1,700. So we are flying blind in Brazil. We actually don't know the extent. Some experts say that the real numbers could be anywhere around 10 to 20 times bigger than the official figures. So I think it's a major risk to reopen an economy without actually knowing the current situation.
Obviously, it's the case with the US. A lot of people, depending on where you live, if you're in a poorer area, you might not have as much access to reliable testing as some of the wealthy regions. Are you finding that might end up being the case in Brazil as well?
The lack of testing in Brazil is kind of general. What we see the big difference is in available intensive care beds, in healthcare coverage in general, for instance, in peripheral states in the north and the northeast, which are Brazil's poorest areas. Sometimes you just don't have intensive care beds in several municipalities and you have to travel to the state capital in order to get any kind of medical access. So that's the biggest issue in Brazil. The lack of testing, unfortunately, is a more general problem here.
Now, we have seen that medical officials in Rio de Janeiro and at least four other major cities there have warned that their hospital systems are actually on the verge of collapse. So what does that mean in real terms if you get sick or if you're seeing symptoms and you want to actually get treatment in Brazil?
It depends a lot on where you are and if you're privately insured or not. Because, for instance, Brazil's public healthcare network has around 13 to 14 intensive care beds per 100,000 people. That's 5 times fewer beds per 100,000 than in the private network. However, only 22% of Brazilians are insured. So now there are a lot of initiatives trying to put the private network under the wing of the Ministry of Health, but that requires a lot of political negotiations and a lot of work in Congress. That's not something for an immediate change. But for instance, in Amazon states, we are already seeing a collapse, and in Manaus, which is one of the state capitals in the Amazon region, it has been dubbed the Brazilian Guayaquil, with mass burials, and it was the first region in Brazil where the healthcare system just simply collapsed. And you see a lot of ambulances outside of hospitals, literally waiting for patients to die inside in order to free space for new patients.
Now, one of the things that we've had seen slow the responses for some political leaders has been skepticism. We did see that with US President Trump. We also saw that initially as well with President Jair Bolsonaro. Now, we know that he recently fired his health minister a little more than a week ago. And he's also faced criticism from the United Nations about how he's handled the crisis, as well as supporting some of these anti-lockdown protests. What are your thoughts on how Brazil got to this point, and really what needs to happen next to make sure that residents as well as frontliners really get the support they need?
Well, to put it mildly, Jair Bolsonaro's approach to COVID-19 has been disastrous because he has been the face of denialism in Brazil. He has called it the sniffles. He has said that, alas, we're losing people, but death is part of life, and that our focus should solely be on the economy. And to his point, if the GDP tanks, all research points out that mortality rates also go up. I know the question is nuanced, and it's not simply choosing between the economy or health. But the problem is he does not admit that there's a problem in the first place. So for us to increase testing to protect healthcare professionals, Brazil just first needs to acknowledge that the problem is severe and the problem is there. He, like you said, he changed his health minister. The new man in office, Nelson Teich, an oncologist, he has been there for a little over a week, and he has still not met with state health officials, which in a country where healthcare system is so decentralized, I think it's an aberration. And he has yet to present Brazilians with his own comprehensive plan to curb the spread of the coronavirus in Brazil.
So then just quickly, as Brazil is still working at this point on containment and still testing as well, what do you think a post-pandemic recovery, both health-wise and economic-wise, would actually look like for Brazil?
Well, I think we're facing a very severe economic depression, and that we barely recovered from the worst recession in a century. That was the 2015-2017 recession. And now we're plunging into an even worse one. And my fear is that maybe we can experience social unrest because political conditions are degrading in Brazil. We are going to see deaths piling up. The numbers are going to go up and up. And we are already, lower income populations in Brazil are already experiencing economic hardship, and that's only going to get worse in the short term.